That moment of panic when your child is sick or hurt, and you have to decide, where do we go? The default is the ER, but a study found that nearly 70% of pediatric ER visits were for non-urgent issues. Common reasons kids go to the ER, like ear infections and fevers, are also treated at urgent care. The difference? Choosing wrong can cost you up to 85% more for the exact same diagnosis. We'll show what urgent care handles, how it saves you time and money, and the signs you still need the ER. So, what is the true scope of a pediatric urgent care? It is far more than a place for simple colds. First, common illnesses, ear infections, strep throat, flu, pink eye. They diagnose and prescribe for all of them. Then, minor injuries, sprains, cuts needing stitches, even many minor fractures can be handled on the spot. Mild asthma flare-ups can be managed with treatments. Skin problems like rashes, hives, and insect bites are their specialty. And stomach issues like vomiting and diarrhea, as long as severe dehydration isn't present. This wide range of services covers a huge percentage of the reasons children need to see a doctor quickly. Why can they handle so much? It starts with equipment. Many have on-site x-rays and labs for rapid tests, strep, flu, and RSV. But the defining factor isn't the equipment, it's the people. The main concern for parents is staff expertise with children. Many urgent care centers are staffed by providers specifically trained in pediatrics. They know children are not just small adults. This expertise extends to a child's comfort. Some centers even use child life techniques to reduce fear during stitches or x-rays. This focus on pediatrics ensures your child receives not just competent care, but compassionate and appropriate care. So the care is specialized and the capabilities are broad. What does this mean for your family in the real world? Wait times in urgent care are significantly shorter than in ERs, meaning less misery for a sick child and less time off work for you. Now for the financial impact. An ER visit for a common issue can be over $1,000. Urgent care, often under $200. For families with high deductibles, this is no small difference. It can be the difference between seeking care and a major medical bill. There is also a hidden health benefit. An ER is filled with critically ill people. Urgent care can lower the risk of a secondary infection. Faster, cheaper, safer, more specialized. But how do you know for sure when you are facing a true emergency? Let's clarify the hard lines. Rule 1. Age matters. A fever in a child over 3 months old can go to urgent care. Under 3 months is always an ER visit. Next, head injuries. A simple bump can be checked at urgent care. But any loss of consciousness, persistent vomiting, or confusion means go straight to the ER. Other absolute ER indicators include breathing difficulty where the child cannot speak, severe dehydration with no tears, or a seizure. These guidelines are definite, but they don't replace the strongest tool you have, your parental instinct. If you feel something is seriously wrong, go to the ER. Knowing these key red flags is the answer. It transforms urgent care from a gamble into a smart, strategic tool for your child's health. So we have seen what urgent care can do and how to use it safely. Now let's connect it back to that shocking statistic from the beginning. Remember the 70% of pediatric ER visits for non-emergencies? By choosing urgent care, you save yourself time and an 85% markup. Every appropriate urgent care visit helps reduce overcrowding in emergency departments. This frees up resources for children in life-threatening situations. The system-wide financial impact is staggering. One study projected that moving low-severity ER visits to urgent care could save nearly $1 billion. The conclusion is clear. For a vast range of common pediatric issues, urgent care is often the superior option. It's specialized, efficient, and cost-effective. By understanding its capabilities and knowing the ER red flags, you move from panic to a plan. You gain control over your child's health care. So here is your takeaway. Do not wait until your child is sick. Take 5 minutes today to find pediatric-capable urgent care centers near you. Save the number. Because being prepared isn't just smart, it is one of the best ways you can care for your family.